And higher premiums for MediShield Life to kick in from next April. It will allow expanded coverage to protect Singaporeans against major health episodes. For more on that, we're joined by Professor Eric Finkelstein from the Health Services and Systems Research Program at Duke-NUS Medical School. Welcome, Professor. First of all, what stood out to you the most in this review, and do you think the shape it now takes adequately addresses the top public health priorities in Singapore?
Well, the review was trying to do a couple of things. One is healthcare inflation has been rising, and so somehow the government needs to increase premiums in order to keep the fund solvent. But at the same time, healthcare has switched from largely inpatient to a lot more being done in the outpatient setting, a broader array of services. And so the government was trying to not only increase premiums to capture rising healthcare inflation, but to also recognize that healthcare delivery is changing. And so in addition to increasing premiums, they've really made a host of changes that increase subvention for outpatient services, for mental health services. And they actually did something really neat, was they allowed premium offsets for people who engage in healthier lifestyles through the Health Points program through Healthier SG, which is something that I think is a first of its kind in the world, where they're actually offering rebates for healthy lifestyles.
That's interesting. I'm glad you mentioned that. But did it not stand out to you the amount that the premiums will be increased as much as 35%? Will it not lead to an increase in the cost of healthcare and the burden on Singaporeans?
Well, you have to remember, insurance is meant for healthy individuals, or in periods while people are healthy, to subsidize those who are sick. And so although the premiums will go up, what you really want to think about is your net out-of-pocket cost. And so if somebody gets sick, the new changes to the system will reduce their net out-of-pocket expenditures. And so it's true that for some healthy individuals, their premiums will go up, but a lot of that is going to be offset for individuals whose total costs, when you consider copays and deductibles, on net will actually go down due to the higher subsidies.
Okay, now MediShield Life coverage will be extended to cell tissue and gene therapy products, CT-GTPs they're called. Why is it so important that these treatments are covered?
Well, again, insurance is meant to really restrict out-of-pocket costs to something that's manageable. And these are the types of treatments that are most expensive and so really unaffordable. And so the idea behind this extended coverage is that, these are things that happen to people through no fault of their own. Insurance is meant to protect the financial outlay. And so the government has recognized that these are high cost yet high value services. And so they've decided it's important to put them into the pool and offset the cost by spreading them across all individuals who pay premiums.
Singapore is on a path towards shifting towards a personalised healthcare. Do you feel MediShield Life review comes alongside that goal nicely?
Well, I think it's part of it. I think personalised healthcare has to extend into public health and into all facets. So I think MediShield Life has a role. I think Health Promotion Board has a role. I think Healthier SG is a significant movement in that direction. And so I think this is beginning to move in that direction, but I think personalized medicine and personalized healthcare is really just beginning. And the idea is that we want to provide the right services to the right individuals at the right time and in the right location, which increasingly is moving out of the healthcare system and into the community. And I think as we move in that direction, we're going to really have to rethink how we finance health services.
Indeed. It's been so interesting speaking with you. Thank you so much, Professor Eric Finkelstein there from the Health Services and Systems Research Program at Duke-NUS Medical School.